House job, or better said the foundation year, is the most important time in a young doctor's life as it lays the foundation for exactly what kind of doctors they will become. Starting from this year, you practically apply all that you have learned during 5 years of your MBBS. You come in direct contact with your patient and you are often the focal person, the first contact a patient will have with the healthcare system. It is during this year that you make your reflexes, your attitude toward your work and your patients. Reflexes thus made stay with you for the rest of your life. House job can be very hectic at times, but at the same time, it is the best year as it comes to the learning. All in all, it's the golden period in a doctor's life. It will be a roller coaster of emotions. You will inevitably feel very sad and helpless facing administrative problems or seeing some mismanagement, while on the other hand, you will feel heavenly relieving your patients of their pain. Running from ward to ward with the calls, running to blood bank to arrange blood of your patient, having a lot of patients on your head in a hectic OPD, having sleepless nights, having 3 AM gossip with your fellow in an emergency call, practicing counseling, breaking bad news. There is a lot you are going to experience. So new house officers, get ready, it's going to be one hell of a year. I am Dr. Zishan Bulayat. I am at the other end of this year, addressing to my juniors at the start of the year who have recently updated their status as Alhamdulillah, finally doctor, and are excited, I hope excited for this year. And let me say, it's worth all your excitement. In this video, I'll guide you to the utmost of my abilities and according to my experience as how to navigate this important year. Before I start, I'll say a house officer can be the junior most doctor of a hospital setting, but he is the one closest to the patient. He gets to spend the most time with the patient. He is the one digging the history. A house officer can play very important role in a better management of a patient. In this video, I'll guide you on how to select your rotations, the preparations you need to make before the start of this year, and some general tips. So let's get started. In the first few slides, I'll be telling some general tips about house job. First is, don't limit yourself. Make your mind that house job is a year of learning, and it is this time of your life that you can learn a bit of everything which is needed for the management of a patient. Limiting yourself to your duties only is not what I'll advise you. Learn to pass IV line, fix oxygen port, run a suction machine, learn ventilator setting, learn everything which is there in a hospital. You don't have to do it once you have learned it, but you should know how to do it. Second is, stay humble, be wise. You might have good knowledge by this time, but on practical ground you need help, so stay humble. Besides what you will learn from your seniors, if you are humble and wise enough, you can learn a lot from your colleagues, the nursing staff, from the Aya, and even from the ward boy. Everyone in the hospital who has got more experience than you can teach you something. As this is going to be your first experience of working in a system, try to learn how to survive in a system. Talking with respect to your colleagues or other staff, asking them how they are doing, offering tea to your OTA or Aya, gestures like these are going to work wonders for you. Believe me, they'll be helping you out of the way only if you win their respect. Next is, ask, learn along. The actual purpose of house job is your training. There are 3 things you need to work on: knowledge, skill, and communication. No one is going to spoon feed you this year. So ask and ask again. Keep a book with you or just Google it along. Whenever you see a case, make a habit of studying about it at the same time or later the same day. You just learn some skill, YouTube it to learn the same method with some international SOPs. Be a smart learner. Fourth is, be kind and calm. Keep in mind that the patient who is in pain or their attendants are not in the routine mindset. They are tense, worried, or probably frustrated by the rush of a government hospital. So it is you who have to be on the listening end, not them. Their loved one is in pain. All they want is their patient to be paid proper attention to. The situations arise. You have to be very, very calm and cool minded in such situations. And talking to them Counseling them is the solution. You just have to win their confidence. Fifth is counseling. Counseling works magic. Unfortunately, it is this thing which you will find the most lacking in our hospitals. Counsel your patients and the close attendants, keeping the confidentiality of your patient in mind. Keep them on board. Keep telling them what's going on. Patients and their attendants will be satisfied with your efforts, no matter whatever the outcome is. The chances of conflict are reduced to zero if you are doing counseling all along. Take a moment to counsel on your prescriptions using simple Urdu. Do great counseling and see the magic happen. Sixth is be professional. In a hospital, it is very important that you carry yourself gracefully. Your dressing, your behavior, your language, body language, everything should be professional. You will improve it with time. Seventh is be responsible. This is important. You must be punctual and responsible. Don't leave the important stations like ICUs or emergency until the next HO comes. Make a habit to take and give over of your patients. Your irresponsibility will make someone suffer in the end, your colleague or even worse, the patient. Eighth is give your best. Just make your mind that this year is the year you have to go through a grind. So why not go through it with some dignity? It's going to be tough anyways, and it will pass no matter you pass it crying all the time or facing it boldly. Try to enjoy it. Give your maximum. If you are doing your duties honestly, you will see the reward, inshallah, and feel the feelings which you have never felt before. The feelings which will make you say, yes, definitely this is worth it all. Next is make notes. In the house job, you learn in parts. You will be collecting knowledge a bit from here and a bit from there. So it's important that you gather it all. You learn points according to our hospitals. And to revise or search the same points from books would require you to go through a lot of literature, or at times you won't even find it. So I'll advise you to make your notes and save whatever you learn. 10th is stay united. A union is strength. During this 1 year, you are going to face a lot of different situations. Staying united and backing up your team is very important. It's better that from the very start you as a class make a house officer representative, and whenever you need to highlight an issue, just go as a group. I'll suggest you to join YDA, they'll have your back. Next is protect yourself. Hospital is a sacred place, but it might not be safe in many aspects. While you will have to spend most of your time in a hospital, it is important that you protect yourself physically, mentally, and in every aspect. Wear proper PPE to protect yourself from infections. Protect yourself physically. Remember that hospital is a public place. You have to protect yourself and your belongings. Protect yourself mentally. In the life you have spent till now, you were more or less like in a protective shell, and starting from this year, you are going to expose yourself to society. It is very important that you understand that in a hospital you interact all kind of people. So it is important that you protect yourself in all aspects. Next is know the system. Try to know the system. Learn how the administration work, what is the proper channel of getting administrative work done. This will help you in your house job. To be honest, house officers are the one who are in actual power in a hospital. You got your class fellows in all the units. If you are stay connected, and you are the one who run the hospital. So maintain your grace and know your worth. Next is take care of yourself. House job can be crazy hectic at times. So it's important that you eat and sleep well, and you get to spend some time in which you can vent out. Try to stay connected with your family and friends. Next is get mentally ready. Things are going to be very much different than what you've been taught or what you expect or idealize. You will get disappointed. In such situations, just hold on, take a deep breath, try doing whatever you can to improve the system. Just play your role. The next few slides are about the preparations and homework you need to do before your house job starts. About the dressing. A doctor's dressing should be professional. It should be decent, neat and comfortable. Here's what I'll suggest. You need to get a bunch of undershirts, a few good decent colored scrubs with your names embroidered or printed on them or a separate nameplate, lab coat, especially for girls, a stethoscope, a wristwatch, preferably a digital one, and Crocs or any comfortable shoes. This set of dressing is pretty decent and comfortable. About the things and apparatus you need to arrange, and you have to carry this with you in most of your house job. This includes a BP apparatus, pulse oximeter, a thermometer, a notebook to save your notes, hand wash or sanitizer to protect yourself or other patients of some patient's infection, stamp with your complete name and designation, a stapler, a bold marker to label the drips, and a lot of ball pens, measuring tape and a scissor. Next appears a list on which you have to do your homework so that when your house job starts you know how to do these. This includes giving a subcutaneous injection, IV injection, giving an IM injection, passing IV line, IV sampling, knowing about the sampling vials, performing an arterial tap, taking vitals, the right method of measuring temperature, BP, blood pressure, heart rate, respiratory rate and BSR, performing CPR, passing an NG tube, passing Foley's, washing wound and wound dressing, the proper format of writing a prescription, performing an ECG, washing and scrubbing for OT, putting progress notes, SOAP, and brand names and dosage of some common drugs. For this list you can YouTube to learn, or even better if you could come to hospital before your house job starts and you can learn it from the ex-house officers, which can be your best teachers at this moment. And for the SOAP and brand names and dosage of some common drugs, I'll attach a link to my drive where I'll upload files for these. In the coming few slides, I'll guide you to plan your house job rotations. This part of video is going to be especially helpful for the ones who are going to do their house job from allied hospitals of Rawalpindi Medical University. In 1 year of your house job, you have to do 4 rotations of 3 months each: general medicine, medicine allied, general surgery and surgery allied. Everyone has to do general medicine and general surgery, and for these two you just have to select the units in which you want to do these rotations. For medicine allied, you have to select any one out of the 10 specialties, and also you have to select the unit in which you want to do it. And for the surgery allied, you have to select any one out of the 9 specialties, and also you have to select the unit in which you want to do it. These lists show all the specialties and units of 3 hospitals affiliated with Rawalpindi Medical University, along with their estimated seats for house officers. Among these units, you have to select any 4 for your house job. Here are some general advices I got for you to help you select your rotations better. First of all, make your mind about the specialties and the units you want to do your house job in. Now this would require some homework. Selecting your allied specialties is obviously going to be your own decision, which specialties you are inclined towards and want to get experience in. Either you want to go easy on yourself or you want to give yourself some tough time this year. There are a lot of factors which influence this. Just do some homework and make your mind. As house job is allotted on merit basis, once you have made your mind about the specialties and units, if your merit is good, then that's all what you needed. But if your merit is near 100 or above 100, then you need some smart approach and planning to reach your desired rotations. The order in which you take your rotations might help you get your desired units. Let me explain this. You have to take 4 rotations. You have to take medicine and medicine allied together, and surgery allied together. But you can take them in any order. There are a lot of possible combinations, order combinations. and you just have to plan which order combination can help you reach your desired rotations. Let's say the high merit chooses the order of medicine, medicine allied, surgery and surgery allied. So you can take any unique order. Let's say you can do surgery allied first, then surgery, then medicine, and then medicine allied. In this way you can get your desired units. Try to get rotations with your friends. This helps a lot, especially the major ones, general medicine and general surgery ones. Also, while you plan your house job rotations, keep in mind if you have some special plans like plab or something like that. To help you select your rotations better and according to your preferences, I conducted an unofficial survey a few days ago to collect feedbacks of house offices of the last year about their experiences with the units of RMU hospitals. The results were shared with you. Here is a screenshot of that file from the response summary, just to explain it to you, and it has a lot of information in it. How hectic the unit was rated, what was the working environment, how was the learning, and what was the overall experience, and what was the call schedule. These values in fact are average of multiple responses by many house officers, just to minimize the confounding and personal bias. This response summary file has a lot of information in it. You just have to look into it with some attention. It might help you with your decision. For those of you who still don't know what a call is, it's a basically 24 hours duty for which you have to stay in a hospital overnight. An alternate call would mean that you have to stay for 24 hours in a hospital on every alternate day, every other day. A call of 1 in 3 would mean that you have to stay for 24 hours duty on every third day. A call of 1 in 4 would mean that 24 hours duty on every fourth day, so on and so far. Also, the house officers were offered to write about their experience of house job. They have written a lot, so you can also get this file in my drive and read these too. Okay, that's all from this presentation. I would highly recommend you to keep a check on my drive. I have made a special folder for you, and I'll be attaching the link in video description. I'll be uploading the important files which you need at this moment before the start of your house job, and the important files which you will have to see and use throughout your house job. So just keep on checking that folder time to time. It will be very helpful. I'd like to pay my thanks to Dr. S. N. Sattar and Dr. Zoha Ali for helping me in this video. That's all from this video. Thank you.